translucent teeth. Can you fix it? Hi everyone, welcome back to my channel. So, if you notice your teeth, you must be seeing that there are certain areas which are actually translucent. Your teeth are not opaque white, right? Like it's not completely white all over. So these translucent areas most commonly we see around the tip of the tooth, as in the biting line. That's why you see this translucency. And a little bit of translucency is very normal. There's nothing for you to worry about that. So when is this? When is that it becomes a concern now? Only when it becomes large and it increases as the time goes. So the usually glossy, opaque and the whitish teeth that you have, and then you see that it is becoming translucent. What does it indicate? It indicates that there is some problem that is happening with the enamel, because enamel is something which is actually formed only once and it is very hard and thick, and the color of the teeth that you see is generally because of whatever is present inside. There is a dentine layer which is slightly yellowish, or if it is more towards the white, your teeth appears white. At the tip of the tooth you have less amount of dentine, that is the biting edges, and because of which only in that area the enamel is supposed to be slightly thinner, and that's why it appears translucent normally. And when it is not like that and the more areas of your tooth is translucent, that means there's a problem. Now how can you avoid having a translucent teeth? 1. Please brush your teeth gently, not like how you scrub your floor, and use a toothbrush which is of soft consistency. Don't use a hard or a medium type toothbrush. Use a toothbrush which has soft bristles, and please be very gentle with your teeth. Enamel is hardest, but doesn't mean that it requires that kind of scrubbing. If you do it like that, the problem is that in the initial years you will never get to know. You feel that enamel is thicker, so can brushing actually remove the enamel? Actually it can. So, and the changes that you see will not be noticed immediately. It's over the long years that you're going to notice, and by the time you notice it, it would have become too much and you will not be able to do anything about it. The second thing that can happen is because of acid erosions. Now acid erosions can happen because of a lot of reasons, like if you're a person who frequently has heartburn. So heartburn is a condition where the internal fluids, they regurgitate into your oral cavity, and if it happens on a frequent basis, the acidic content of the stomach will come to the oral cavity and it can cause a lot of erosion of your tooth surface, most commonly seen on the back side of the upper teeth and also on the chewing surface of the teeth. Other than this, erosions can also happen because if you are having undergoing any treatment for cancer like chemotherapy, or you are having any other illness, it can be mostly because of any other physical conditions, which an underlying physical condition, which in turn is causing this damage to your teeth. Acid erosion can also happen because of a lot of drinks that you are having, like soda or any energy drinks, or almost all the soft drinks. They all have a lot of sugar, which is anyways bad for you. Along with that, the pH of these things are highly acidic, which is going to damage your teeth. It's going to cause erosion and ultimately lead to loss of enamel, which in turn is going to lead to translucent teeth. So make sure that whenever you are having all these kind of drinks, please try maximum that you are able to use a straw while drinking. If not, immediately rinse your mouth after the drink. Okay. So the next one. The next one is because of having a high sugary diet. It's seen that whenever you're consuming high sugar diet, you know that already the bacteria in the oral cavity, they feed on these sugar. So you're providing more amount of sugar to them. They feed on and they actually start digesting more and more, and the byproduct of all the fermentation and eating of these bacteria, the byproduct is what is generated is acidic, and this in turn is going to increase the acidic environment in the oral cavity, leading to the same thing, that is loss of enamel and erosions, which in turn will cause the translucent teeth. Next common cause is having dry mouth. So the amount of saliva will be very less, so the cleansing action will be reduced, the bacteria which is present will be like harboring everywhere. Also, it's seen that the dry mouth can also cause what is called as the translucency of enamel will be increased. So in case of dry mouth, the condition is because of a lot of reasons. So if you're able to find what is the actual reason, then better treat it, because over a long period of time what you see is that patients who are having that, they will tend to have enamels which slowly becomes thinner. So go to your dentist, tell them about your condition and try to get it treated. So if you are having this translucent teeth problem, how are you going to fix it? Number one, find out what is the cause of this. If it is because of you having a very hard bristled toothbrush and using it in a very hard and difficult way for your teeth, then please stop it immediately. Start using a soft brush and be very gentle with your tooth. That's the first step to not having a translucent teeth. Second thing is that you change your diet. If you're consuming a diet which has higher sugar content, if a diet which has a lot of acidic drinks, energy drinks and soda, then try and reduce that. And the third thing that you can do about this, please go and consult your physician. Check if you are having any underlying cause like a heartburn, which can happen because of a lot of reasons. So check if there's any other problem which is actually causing this, and do visit your dentist once you find out what is the thing. If you are not able to find out, go to your dentist, tell them that I'm having this problem. They will be able to examine you and maybe give you a better suggestion, because of which you will be able to do this or that and then avoid having a translucent teeth over a long run. Other than all this, if it's because of enamel issues, your dentist is also going to advise you to start using a fluoride-rich toothpaste, which is going to help you remineralize and make your enamel stronger. Plus, if you're still unhappy with all these things that you're doing and still you're feeling that no, my teeth are not beautiful enough, then there are options like crowns and veneers. And veneers is a much expensive option compared to crowns, but most of the cases it's minimally invasive procedure, and there are a lot of patients who actually go for veneers, and they are going to solve your problem of having a translucent teeth and make your smile beautiful and better. That's all for now. Please like, share and subscribe. Thank you.